Hey everyone, welcome back to the channel. Today we're diving into some major changes coming to the Affordable Care Act, also known as Obamacare, starting in 2026. These updates could reshape health coverage for millions of Americans. Some people will benefit, but many others could face new challenges. So let's break it down in simple terms. Who wins, who loses, and what it all means for you. It means the end of extra subsidies. For the past few years, millions of Americans shopping for health insurance on the marketplace have received extra help paying their premiums. These enhanced subsidies made coverage more affordable, capping premium payments at about 8.5% of a household's income. But here's the big news. Those extra subsidies expire at the end of 2025. That means starting in 2026, unless Congress acts, many families will see their premiums jump dramatically. For example, analysts expect average net premiums could rise by more than 75% for some households. And according to government estimates, enrollment could drop by nearly 4 million people in just 1 year. So who benefits here? Honestly, not the consumer. The main winners are federal budgets, since the government saves billions by paying out fewer subsidies. But for low and middle-income families who rely on that financial help, 2026 could bring serious sticker shock. Or the new marketplace rules. Another big change is the new Marketplace Integrity and Affordability Rule. Sounds fancy, but here's what it really means. People automatically re-enrolled into $0 premium plans will now be charged a $5 monthly fee. Stricter checks will be required to prove income and eligibility. Enrollment outside the standard window will be harder, with fewer special exceptions. On paper, these rules are meant to reduce waste, prevent fraud, and save taxpayers money. In fact, the government expects premiums to drop about 5% overall and taxpayers to save up to $12 billion in 2026. But here's the trade-off. Experts estimate that between 750,000 and 1.8 million people could lose coverage because of these extra hurdles. In other words, the system will get tighter and cleaner, but fewer people may be able to stay insured. What are the Medicaid and work requirements? Now let's talk Medicaid, which covers low-income Americans. Under new budget laws, states may soon require many adult Medicaid recipients to prove they're working at least 80 hours a month or participating in school or volunteer activities. There will be exceptions for seniors, pregnant women, and some people with disabilities. But for others, missing paperwork or failing to report hours could mean losing coverage. On top of that, some Medicaid enrollees will face cost-sharing fees up to $35 per medical visit. And immigrants may face longer wait times, like a 5-year waiting period for green card holders before qualifying for coverage. So benefits here? Again, it's mostly the budget, since these rules are projected to save over $1 trillion over the next decade. But who doesn't benefit? Low-income workers juggling unstable jobs, immigrants, and anyone who struggles with extra paperwork. Shorter enrollment windows. If you've signed up for coverage in the past, you know open enrollment usually lasts until mid-January. But starting in 2026, that window closes on December 15th. That means you'll have 1 month less to pick or change your plan. Also, the special enrollment period that allowed low-income individuals to sign up anytime will be eliminated. Going forward, you'll only be able to sign up outside of open enrollment if you have a qualifying life event, like losing a job or having a baby. This change benefits insurers by giving them more stability and fewer mid-year signups. But it hurts people with unstable incomes or those who simply miss the deadline. Who are the wins and who loses? Let's sum it up in plain English. Winners are the taxpayers and federal budgets, which save billions by cutting subsidies and tightening rules. Insurers, who may see lower costs and fewer mid-year disruptions. People with stable jobs and clear paperwork, who can more easily keep their coverage under the new system. Tax-savvy individuals, for example, those using health savings accounts, which will expand to cover direct primary care in 2026. Losers are the low and middle-income families who face big premium hikes when subsidies expire. Medicaid enrollees, especially those subject to new work requirements or fees. Immigrants, who face longer waits and more restrictions. Anyone who relies on automatic enrollment or misses deadlines, since the new rules are stricter and less forgiving. So, 2026 is shaping up to be a year of big change for Obamacare. For some, it might mean more stability and even lower premiums. But for millions of others, it could mean higher costs, stricter rules, or even losing coverage altogether. The bottom line? If you rely on marketplace insurance or Medicaid, pay close attention to these changes. Mark your calendars, double-check your eligibility, and don't wait until the last minute to sign up. If you found this breakdown helpful, hit that like button, subscribe for more updates, and share this video with anyone who needs to know what's coming. Health coverage is complicated, but together, we can stay informed and prepared. Thanks for watching, and I'll see you in the next video.